Thank you for letting me speak today about a program that I've become really impassioned about. So I'm on Wurundjeri land in Melbourne today. I am an emergency physician at Eastern Health, and I'm also director of the medical student programs at Eastern Health Clinical School, which is part of one of the metro sites for Monash University. Our final year medical students undertake a unit on patient safety composed of teaching on the recognition and management of clinical deterioration. And this is a mix of theory and practical skills such as airway, fluids management, basic life support, and building up to practicing teamwork skills during immersive simulations on various scenarios of clinical deterioration. The total program is 3 days in the sim lab during their final year. And it's a very popular program with students. They sort of love getting in there and learning these skills and having the hands-on teaching. But traditionally, medical students have undertaken this program in their professional silo. And until this year, students at my clinical school, Eastern Health, attended one of the other Monash metro sites to undertake this unit, but we decided we'd like to prepare to take this teaching on ourselves in 2020. And so it was a really good opportunity to think about how we might do this a little differently and whether there are opportunities to do things in a different way. And it seemed very logical to see if we could undertake this in an interprofessional type of setting for a component of this program. So we teamed up with our Eastern Health Interprofessional Education Coordinator, Anne Smart, and we began preparations in 2019, a whole year prior to our taking on the formal assumption of the program, developing and trialling the interprofessional component as a standalone session. We formed a steering group with 5 professions who were interested in progressing the concept. So it was medical, nursing, physio, radiography and pharmacy. And our initial discussions really centred around what level of learner would gain most from the session. And it was felt that grad nurses and interns in physio, pharmacy and radiography would be best paired with the pre-intern medical students. We also constructed scenarios that would enable all learners to gain from participation. And we looked at the logistics of running sessions, which was no mean feat, including pre-briefing, debriefing the whole group, plus managing the flow of students through the various scenarios. So we collaboratively formulated 5 deteriorating patient scenarios, and they were set in various settings across the hospital, obviously in the sim lab, but simulating an acute chest pain in ED, for example, anaphylaxis in the imaging department, a physiotherapy session where a patient becomes hypoglycemic, a surgical ward with some sepsis, and an anemic patient in the medical ward. And following a pre-brief, learners were divided into small groups and commenced assessing and managing each scenario. And they were rotated between scenarios. You can see here how they were each around a bedside and working together to manage the patient. A facilitator drawn from one of the professional groups was present at each scenario as an observer and a debriefer, and these staff were primed with the learning objectives for each professional group in their scenario. Final year medical students were used as sim patients, which allowed interesting perspectives to be explored during the debrief. The scenarios themselves lasted 10 minutes, with 8 minutes debrief and 2 minutes moving between the stations. And it was held in the education precinct, which had a small simulated ward area that you can see in this photograph. And there were several other rooms that could be mocked up as an ED cubicle or an imaging holding bay. The enablers of this was the enthusiastic support from all professional groups, our administration support with sending out pre-reading, participant contact prior to the sessions, name badges, evaluation, and moving patients between areas at the right time. And I think also a significant factor was that it was already part of our formal curriculum, and it just fitted in so logically. It was a ready-made structure for this program to be fitted in. So we were able to do a few sessions of the standalone component before modifying it to a smaller three scenario session. And And then the challenge, of course, of 2020 came, and we had to put a lot of it online and not have face-to-face sessions anymore. So at the moment, we're planning to go back to face-to-face sessions for 2021. And I'd like to share with you some of the feedback that we received when we were doing it face-to-face. Everybody enjoyed it, thought it was good, and they recommend it to their fellow students. In terms of the learning objectives that we had, gave them an opportunity to maximise learning opportunities, further insights into other professional roles, increase confidence in working with other disciplines, encouraged students to refer or request consults with other disciplines. It was beneficial to learning, more beneficial to learning than in a silo. And here were some comments from participants. And the themes here were really about the value of learning about other professions and learning with them, the feedback that they got, learning about what professions offered in various and their scope of practice, and they enjoyed the various scenarios that we constructed for them, felt that it was a fun way to learn.
Thank you, Deb.